I feel that we doctors in general are losing our dignity. And when I started searching in the social media, in Google, I find such like photos, names. Okay. So this obviously is for the Western countries. So when it is like that, when they think about doctors as sadists over there, I don't know how our people think about us. Anyway, they may not be getting as much respect as we do here, thankfully, till date. But I think we are also losing our dignity, and it's high time that we should start thinking about it. This is the exact meme of how the administrators in our country think about doctors. And I faced it, believe me. Okay, so it's high time that somebody should stand and talk about it, and we discuss about how we can bring a change in our dignity, to preserve our dignity. If you ask me, am I the right person to talk about dignity? No, I don't claim that. Okay, I am as much as the part of this undignified, whatever has happened to lose this dignity, I'm as much responsible or more than any of you present here. But I thought, if not me, then who? I didn't see anybody coming forward, so here I am. Certain disclaimer I have, especially for the residents. My presentation, you must have felt that it is quite different than the norms. So I'm not teaching you that you should also follow this. You just watch it and don't follow it. I think I'm a very unconventional person. I don't usually follow what 99 people follow. I like to be different than the rest. So you're the pakai then. I don't think you, and I'm sure you learned something at least. Thankfully, I always get good reviews, and I hope to maintain that dignity in this presentation as well. And over these years, after presenting in different forums, what I've learned is if your presentation is not full of humor, nobody is going to listen to you. Especially in conferences, we all know we go to the conference to many other reasons than to listen to the conference talks. Okay? So, and the presentation that is liked by everybody happens to be humorous. And I think one of the examples is Professor T.S.S. Rao. Anybody has attended Professor T.S.S. Rao's lecture? Yeah. It is humorous, right? Even Pujan, she likes to go to that presentation. So I try to encompass many things like that. And what I'm telling you and what you get, perception is very, very, tricky thing. What I'm trying to convey to you, what you're seeing, what you're hearing, it may have different meaning to you. Like in this picture, what we tell to the patient and what they perceive may be totally different. So I want this presentation to be interactive, and as it is mainly based on my experience, so I don't claim that they are true and they are authentic. You can always come and challenge me and debate with me and prove me wrong. I'll be very happy. So going to the presentation now, I will begin by how is the journey to become a psychiatrist, and then OMG experience after finishing psychiatry, and challenges as psychiatrist and where the future should go. You know, MBBS happens to be the most difficult subject in the world, proven by Guinness Book of World Records. It was, I think, CA or before, but now MBBS has taken over as the most difficult subject to pass. After passing that subject, we have so many chances of doing specialty, and finally we choose psychiatry. But I don't know. During our time, we were asked by our colleague, "Didn't you get other subject?" You know, when we would say that I'm psychiatry resident, I don't know, they face that or not. They would have a frown in their forehead and say, "Really? Did you get other subject?" This doesn't take it. Okay, that was what I have faced. And then after passing, also the career path is very, very stiff. Okay, it's not easy. You pass as a psychiatrist and you go and you start having very good practice. That is not always the case. Your time, this is the original lyrics. I don't know if you know it or not. You know this?
I know this song.
Yeah.
This 3 modify version was it?
No. That's the original lyrics. But then they thought that it is so disheartening to the doctors, so the lyricists will change it to something else. Alright? So after passing, these are some golden words that we are given, that we take oath for. Good people skill, partners with patient, and whatnot. And then we get your stars, okay, this is how you are supposed to be. Okay. Then we are ready to face the world, right? And we know from different data that 1 out of 4 people in this country is mentally unbalanced. Now, this is there in every research in every country, and then we think that we have a lot of patients waiting for us. Then the oh my God experience. It starts with getting a job, and then the salary that we pull. Okay, it is far different than what our parents would have envisioned, or the society thinks, or the administrators think. This is how still the administrators, the politician, the general public, your family, this is what they still think. So reality is different. And then the scenario these days, we are losing our dignity. So people do a lot of other things. We sacrifice our social life, fun, sleep, and then for our duties, exam, and what for? Okay, this which one is the doctor's car? And this is what our gurus tell us, lot of scopes. This is so disheartening, we struggle so much, we go through so rugged path to become a doctor, and this is how others would think that it's too easy. Then and then comes the real part. The Hippocrates oath becomes Hippocrates oath. This man, Hypocrite, I think your name so we become hypocrites then. You know? And history taking then becomes only a task to pass our exam, or only a task of resident or medical students. We don't do it. This is the scenario in America. I don't know the exact research year, but must be मैले 5-7 वर्षै भइसक्यो यो स्लाइड देखाउन थालेको भनेपछि it must be about a decade old at least. So, 290 people in America alone died because of prescription medicine. Okay, sometimes I feel like I'm a Gabbar Singh or James Bond, And then these are things these are medical secrets, only known to us and hidden from the public, but we cannot talk about it. These are some very known facts, but we put it aside in our practice. Anyone to challenge this? See, I have a lot of strong statements, so I want my some of you to come and challenge me and prove me wrong. Really, मेरो abnormal belief हो कि see, this is of course in developed countries where they are forced to take leave for 2 days, santosh, and they are still asking for relaxation time. They are saying their work hours are is too much, and what we do here, I think we hardly have time. This is especially for us to remember always. Patients don't suddenly deteriorate. We just suddenly notice. And this happens when there is an incident in Pokhara. I think after I came to Pokhara, I don't remember the exact count, but it must be more than maybe 20 cases. Recently there was one in Fevasi. We all remember it, right? And when it comes, then we start digging into our faults. Then we start correcting our paperwork. I don't know why we are not changing. Why we are waiting for accidents to happen. Yeah, it's high time. This is, oh my God, experience. Challenges as a psychiatrist. Workload, like we said, 1 out of 4. What actually happens is they think, other medical fraternity, they think that, and people in general, they think that only those who are insane are psychiatric patients, while they do not know that 95% of patients who are actually who have psychiatric illness are dwelling in the society, and those are the ones who are having very bad quality of life. They need a very bad quality of life. In fact, I would say that 5% who actually who are referred to us, they are better off than those 95% patients, because they don't know that where to go for help. They go to different other specialty, and they are just I have a proverb which I think tell how their state is. आसमान से गिरे खजूर पे अटके. Do you know that saying? आसमान से गिरे खजूर पे अटके. So that's what happens to them. I think that's how they would be feeling, and we become like a jokers. You know, I think I proudly say that we psychiatrists are like Sikhs in India. India was Sikh or like jokers, okay? And I studied from Pakistan. Their Pathans are every joke in Pakistan is on Pathans. Like in India it's Sikh. So in medical fraternity, I think we are serving that, and there is no harm in that. Let's enjoy it. And I think we are the specialty which is still misunderstood and rapidly growing. So we have to keep ourselves abreast. I don't know how frequently the surgery for appendectomy would change, technique-wise or pathophysiology-wise, how often it would change. But in psychiatry, I think it is changing rapidly. So we have to keep ourselves abreast. So it's a very challenging field. Work environment here, the most challenge we get is from the prescription medicines. We think, I'm sorry, it may sound very rude. We psychiatrists have restricted ourselves in a closed room, just prescribing medicine to the patient. And I don't think that is what a psychiatrist should be doing. When I was in PAN, in executive committee, some of our junior colleagues, they would, especially from Kathmandu, they would come and complain to us that Falano neurosurgeon, Falano cardiologist, they are prescribing escitalopram, they are prescribing amitriptyline. Oh, one physician, he even prescribes olanzapine. I said, yeah, they have right. They are MBBS graduate, they have right. What you have to prove is you are better than them in prescribing those medicines. In reality, what happens is that same patient would consult for similar amount of time, get similar information, and what he gets in the end is same medicine. So why would that doctor trust you for just prescribing medicine? You have to prove to them, to your colleague, that you are better prescriber of olanzapine, you are better in prescribing escitalopram. Okay, that you have to prove. And we have not done anything to prove that. And we are just crying. Halano you got it, this kind of you got it. And I don't know why so many molecules come in the market. I really don't know. This could be, for instance, it has a maybe Dr. Santosh, you know. And then regarding handwriting, I'm sorry, molecule notice. NMC has published a notice time and again telling doctors to write their handwriting in legible script and to doctors to keep record of their patient. And we are not doing it. Recently, I had to go to the court for a case. Thank God I keep all the records and I could face the lawyer, They can be so nasty to you. If you don't have your record, they will make it school item. Believe me, we have to keep the record of the patient. I don't know how we will do that in Fiscal Hospital, but we have to. Our capacity. And then again, we have to, there are 3 crore doctors in Nepal. So there will be 3 crore psychiatrists whom you have to compete. These are some very common scenario, especially in Terai region, you know, how they are about to practice, I don't know. And the biggest challenge we have is from the pharmacy. One incident I still remember, one lady came and it was a case of migraine headache, and then one of the senior doctor in GMC brought her to me because she was her his relative, and I gave her Elin. Elin is amitriptyline, one of the trade name, and she took Elzin. Elzin भनेको के भन्नु त? BPH मा दिने. Alpha. She took alpha-zocin for 1 month. Can you believe that? And our own pharmacy did it. So that's why I always tell you to ask the patient to bring the medicine and take it. And another phenomenon I fail to understand is when a patient is improving from one of the molecule, whatever it may be, which is used in the same disorder, why other colleague may have to change it? To show what? I don't know. We should stop doing that. It is so demeaning the other colleague. You know, it's so bad. I don't like it really. To Kina Gorsa, I don't know what is the psychic behind it. Another challenge we have is businessization of medical practice. If you see now all the business house, they are coming and they are owning the medical school, medical college, big hospital, corporate hospital, and I heard they give you target to meet. You know, this is what happens when in model they start advertising. And what government policies we have to work under. This is what one of the government the senior most government authority of Gandaki Pradesh. We went to meet him in one of the incident that happened in BG hospital. I tell you exact what he said. The Dr. Basanta was there, Dr. Rani was there, and one more doctor I remember, and I was there. He told us, Doctor, yeah, बिरामीलाई धेरै औषधि लेखिदिनुहुन्छ, धेरै इन्भेस्टिगेसन गराउनुहुन्छ, त्यो इन्भेस्टिगेसनबाट पनि पैसा कमाउनुहुन्छ, औषधिबाट पनि पैसा कमाउनुहुन्छ, हैन, यहाँको कमाइ धेरै हुन्छ. ठीक छ, अब यस्तो घटनाहरू घट्यो भने त्यो पीडितले चाहिँ 5-10 लाख रुपैयाँ पाउँछ भने हामीले पनि ठिकै छ पाइराखोस् न भन्ने नै मान्यता राख्छ. I salute him. He was so honest in saying that. That is exact mentality of the government's toward doctor. Believe me. अब यो पोखरामा मात्रै हो कि मलाई थाहा छैन. So we are all alone in this fight. That's why मैले यो कुराहरू जहिले पनि भनिरहेको कारण चाहिँ we have to unite. You know, Nepal Medical Association को slogan छ कि unity, fraternity, service. Unity पहिलो, fraternity, service. हामी खाली service oriented भन्छौँ. We don't ignite. के भनौँ न?